Hi, this is Dr. Nisha Vishnu, and you are watching part 3 of the Brachytherapy series. Obviously, if you watch my first and second videos, links of which is being shared in the description, your understanding of this video would be far better. So, in this video, I am going to explain interstitial brachytherapy. Interstitial brachytherapy is usually advised to cervical cancer patients with some residual or leftover tumor after the external beam radiotherapy. It is a semi-surgical procedure wherein there is no actual cutting, but hollow needles will be placed through your perineum or the bottom directly into the tumor. Some of my patients get really scared when they listen to the technique, and it takes a lot of convincing for them to agree. Let me be clear that if indicated, this technique is life-saving and skipping would alter the result of your cancer treatment drastically. Don't worry, we will do it under anesthesia and you won't experience any pain. So, how do we do it? The day prior to the procedure, you would be asked to do some blood test, imaging, ECG, etc., and you would also be meeting the anesthesia team. They will be asking you some questions and also explaining to you the risk and the benefits of anesthesia. You would be kept nil per oral, that is, empty stomach from early morning. We will put a pipe to drain your urine, as for the next 2 days, you wouldn't be getting up for urination. Your radiation oncologist will thoroughly study your MRI and all the other imaging and work out a plan to place the needles. I usually use the guidance of ultrasound to place the needles into your tumor while avoiding the bladder and rectum. These needles are hollow and is fixed onto a template tightly secured onto your body using sutures. Once all the needles are placed, you will be shifted and a CT scan will be taken. On the CT scan, we radiation oncologist and physicist plan as to where all the radioactive source should travel through the needles and how much time it should dwell in a particular area. The end result is a plan wherein a lot of dose is concentrated in your tumor, killing it, while not much is delivered into your bladder or rectum. In the brachytherapy room, each needle will be attached to our HDR machine through hollow tubes, and once the machine is switched on, the radioactive sources will travel into your body, stay for a few seconds in designated areas as per the plan, and finally come back to the machine as per the plan. After this, you will be shifted back to the ward, given rest of around 6 hours, only to repeat the radiation again. You will be lying down with the needles inside. To my patients, I fit a pump with a control in their hands, which could pump in analgesics or painkillers as the anesthesia effect starts to wane off. 3 to 4 such sessions will happen over the 2 days, and you are done. Of course, there is discomfort of lying with the needles, but let me assure you that you will be well supported with painkillers, antibiotics, IV fluids, and a lot of TLC or tender loving care throughout the procedure. And there are no better or more effective alternates as of now for this technique. After the needles are removed, we usually keep our patients for a night for observation, and next day, if everything is stable, which usually is, you will be discharged with a few medications. You will experience some urinary burning, some pain in the perineal area, bleeding, and sometimes altered bowel habits. But most of my patients are fully healed in a matter of few weeks. Please refer to part 1 of my brachytherapy videos for details on side effects. Although the main follow-up scan is scheduled 3 months from the completion of the treatment, we usually schedule a follow-up visit 2 weeks after the treatment to check on your well-being. I hope I have explained the procedure of interstitial brachytherapy without scaring you too much. Please clarify any smudgy areas of understanding with your treating radiation oncologist. Thank you.